Whatever the cheapest price is today, give it 3 years and it'll be the most expensive rate. Why are we thinking through the front mindset of, I want the cheapest rate for my 65-year-old client? All we're thinking about is 1 year. What should we be thinking about? We should be looking at their rate long term.
Whether you're selling a MedSup or a Medicare Advantage plan, like our message to our clients, our prospects, I feel should be, these are health plans first,
Yes.
right?
Yeah.
And so we really need to make our decision based on, what do things look like if I end up in the hospital?
Hey everybody, welcome back to Medicare Agent IQ. I'm Raul Gonzalez.
And I'm Oscar Ibieta.
And today we have a guest from Physician Mutual, Robert Davis. And Robert, thank you so much for being here.
Yeah, I'm excited to have a conversation. This is going to be great.
Yeah, man. You're the first carrier that we've invited on to the podcast. So, yeah.
Wow, that's an honor.
Do the round of
yeah.
applause.
Yeah.
Thank you.
Yeah, man. Super excited to have you. Do me a favor. Why don't you just, for those that aren't listening, I know that for a long time you guys were mostly focused in Texas.
Yeah.
And
So I have been based out of Texas the whole time with Physicians Mutual. Now I work with agents nationwide. Now, Physicians Mutual's got a really cool story. We've been around over 100 years. Like back in the early 1900s is when we were founded. What's really, I think, when agents think about Physicians Mutual, they're thinking about us 5 years ago. So 5 years ago, we ran a captive shop. And so what does that mean? That means we had exclusive agents that only sold our product. Now, the only reason I think a carrier is going to stay in that model in today's world is because they don't believe in their product. And we believed in our product. We believed in our offering. And we think that we have products that you don't see anywhere else. So about 5 years ago, we entered into this independent space, got to start working with independent agents, agency partners, and we've just exploded nationwide.
yeah, that's awesome.
I remember that. I remember getting into the business. I got into the business in 2013, and I remember seeing Physicians Mutual, and I asked Raul, can we get that contract? He's like, we can't. They're captive. They don't offer it to us. So it's nice that you guys have rolled that out because we see the value in it, and so that's pretty much. That's what today's about, right? It's talking about Physicians Mutual and what you guys bring to the markets.
Yeah. What's your AM Best rating?
We're an A+.
Yeah, and that was just recent, right?
Yeah, so we're A+. We're pretty much A all the way around. Here's one thing I would tell you on that side that's important, is that what you can do for a rating, if you're a carrier, you know what you can do, which is kind of scary? You can pay money to get a good rating. Wow. We've been A since the beginning. My suggestion for agents, there's an organization called Weiss Ratings. Because it seems like you go in AM Best and it's like every company's an A.
Right.
This is amazing. They're also financially strong. But there's a company out there called Weiss Ratings. And what they pride themselves on is they do not take money from any financial institution. And we've been an A+ there forever. Financially, we're sound. And here's the other cool thing. And I think agents, this is important to an agent, but especially important to a client. When it comes to someone calling Physicians Mutual, when someone answers the phone, they're going to be talking to someone in the States.
Nice. When
When you call someone and the person on their line says, hey, my name's Jan, their name's actually Jan.
Yeah, that's good stuff right there, man. Real quick, and actually, where are the call centers? Where do you guys have?
Yeah, so everything we do is based out of Omaha, Nebraska.
Really? Okay.
So we have a really strong presence there. We've been in Texas for a long time. But yeah, everything's there done in one building.
Okay.
There in Omaha, Nebraska.
That's cool. That's cool. So all those employees are actually in Omaha. Very cool. Let's talk real quick about kind of I think you guys have like your flagship product, right? Which would be the Innovative Plan G.
Mm-hmm. Yeah, so we pride ourselves on being different. So usually when we think about the Medicare Supplement space, we think about a standardized world, right? Every company's selling the same product. Now they might tweak things a little bit, they might have little added bonuses, but it's all the same. At Physicians Mutual, we have an Innovative Plan G. We actually rolled it out all the way back in 2009. So we've had this patent for a while. And basically the concept is this. It allows clients to lock in a lifetime discount, but taking on a disappearing deductible day one. And so here's the concept. There's 3 Gs, right? There's the standard G. And when you go to the doctor, what do you have to pay? You have to pay your Part B deductible, $283. Here's the plan that I think is one of the best plans in the market that nobody sells, a high deductible G, right? Every carrier sells a high deductible G, but I think most agents misunderstand how it works. So when you go to the doctor, what happens? You go to the doctor, you're going to pay $283. But then what happens next is Medicare kicks in, Medicare's going to pay $80, the client's going to pay $20, up to a max out of pocket, which this year is $29.50 of Medicare approved charges. And if you start looking, so very few agents have gone here, but if you go to medicare.gov, you type in procedure price lookup, you can find out how much everything costs, like a chest x-ray. How much is a chest x-ray? It's like $200, $300? No, it's $37. So if Medicare's paying $80, you do some quick math, that's a $7 copay for a chest x-ray.
Yeah, I think there's a big misconception on how the high deductible works, to your point, right? That you think $29.70, is that what you said? $29.70 is what?
$29.50 is the max out.
So the consumer, or maybe even the agent, might be thinking, okay, well, my client is going to have to pay $2,900 out of pocket before they get any coverage, and that's not the case.
That's not the case.
Medicare's paying 80%. They're paying 20% up to $29.50. And then that's it.
And how many agents in our Medicare space sell plans right now where the MOOP is a lot more than $29.50? A lot. Yeah, a lot. So here's the beauty of the innovative, because you have to understand both sides. The way the innovative works, if you look at our G rate and you take a 35% haircut on that, you have our innovative G rate. And so that innovative G, day one, it's going to work like a high deductible. So it's going to have a max out of pocket for the year the client purchases plus 2 calendar years. When that period ends, it turns into a full G. Okay? So what we see is if we look at a G, our G versus the innovative G, over a 30-year span, the client is saving significant funds because they started at a lower rate. But here's the thing that I think is scaring, and you guys have probably seen this in the Medicare supplement space, rate increases. And so the question is how, number one, why are we seeing higher rate increases in the Medicare supplement space? And then number two, and I think this is an important question, I think agents and agencies should be asking carriers this question, is what are we going to do about it?
Right.
Yeah, it's been honestly like I've been thinking about this a lot lately, and it's like, man, like you enroll somebody, when they're 65 or 67 when they're retiring into a Medicare supplement, and I've always talked about it where like I've enrolled people, and then like 8 years later, 9 years later, they're like 3 times as much as they started, and they're on an Advantage plan. It's like, well, you just wasted all that premium for all those years, all those healthy years, and you wasted all that premium. So I have been curious. Is would you say that Innovative Plan G is kind of has like there's an answer in that type of plan?
Definitely. And I think there's a couple important things. You bring something up that I think is so critical. What we don't want to do is you sit down with this client. I think this is an important question for agents. Because you have some agents that lean more towards MA. You have some agents that lean more towards MedSup. I think what's important for maybe that agent that leans more towards MA is this question. When you sit down with a client and they say, I want a Medicare supplement, it's important for that agent to process the why behind that and to know. Because I mean, we've probably all seen it, and on both sides of the coin. Like, if I'm a MedSup agent and they want an MA, it's like, why would you do that? And an MA agent's the same thing. So what's the why behind a Medicare supplement? Because I think that's critical. Because long term, do we need this product? Okay. So the why is very simple. That client wants a certain level of freedom and flexibility. They want to choose their doctors and their specialists. They want to choose their hospitals. Like we're here in Texas, and probably nationwide people feel this. In Texas, if you get diagnosed with cancer, where do you want to go?
MD Anderson.
But there is no MAs accepted by MD Anderson.
Right.
I would say, and again, maybe I shouldn't say this, there is one. It's called Kelsey Care, and if you live in Houston, then you're good to go. But everyone else, we're not there. So they want that freedom and flexibility. They don't want to deal with prior authorization, right? I work with an agent out of New Braunfels. Her mom turned 65. 6 months later, gets diagnosed with rectum cancer. She's been waiting 3 months for an MRI. And so they don't want to deal with this prior authorization. And they kind of want this idea that whatever benefits they get day one will be the same for the rest of their life. But you bring up a really good point. That person that wants a MedSup, do they want it just at 65 and 66, 67, or do they want it their whole life? They want it their whole life.
That's the big question.
Yeah, so couple things. I think agents need to look in the mirror, number one, okay? Number one, they need to look in the mirror and make sure that when they're going to the quoting software, and I do the same thing, how do we rank MedSups? We rank them by price. And usually we start at the top, and those are the most compelling products.
Right.
The problem is, in the state of Texas, there were 6 plan exits last year, MedSup carriers exiting the market. You know what those 6 were? The ones that were the cheapest.
Right.
Like probably the leading one was Allstate. They're in the market, then they're out of the market. So the number one suggestion I would make to an agent, again, not that MedSup is your whole business model, but when you do sell a MedSup, make sure you're working with a legacy company. So United Healthcare is a good example. They are getting ready to take a rate increase probably, I was thinking this month, it might be next month. So you want to keep an eye on that. But you want to work with legacy companies, United Healthcare, Mutual of Omaha, Blue Cross, a company that's been in there a long time. Now, what we've all seen is sometimes we make bad choices. One thing that's leading to higher rate increases, I'm going to kind of work backwards from where I usually go, is number one, there's this idea that carriers will make. It's called charter rotation. And so all that means is when a company comes out with this new product, do they want the best price in the market? Of course they do. So they lower their rate to a point where they know that agents, when they see it, they'll sell it, okay? And so they start with this low product. Then the claims start coming in. And when claims come in and they're too high, well, you need to do a rate increase. No, we're not going to do a rate increase. We're going to keep the rate increase low. We're going to keep the rate increase low. And then about 4 years in, they close that block, they open a new one, and everyone that you put on that block, that, you know, that lady at 65 you put in, she's like, why did my rate go from 108 to 300? Right. Is because of that. Now, what's happened, it usually was just one company. Like maybe it was Mutual Omaha this year that took this. Why did they take this massive rate increase? Usually there's one. But what's happened in the Medicare space is there's been this perfect storm over the last 3 years. So number one, I'm tired of talking about this, but we all have to remember back to 2020. We had this concept that for about a year, nobody was going to the doctor. Mm-hmm. So actually claims were way down. You had MA carriers just throwing out goods to people because they're like, we got to give them something to justify this. MedSup carriers, we have to find something to do. And so you had this perfect storm where it went from no claims to medical inflation, which is doubled. Okay, so inflation is through the roof. Usage is through the roof. So that's number one. Number two, what we really have seen is you see these MedSup carriers that are running into a problem where their loss ratio is getting out of control. Okay, so there was a well-known carrier in the state of Texas. They were selling 2 MedSups last year. One of them was really competitive. Right. And come to the end of the year, they pulled that off the market. Why? Because they're dealing with the same problem, not to throw them under the bus. Is a G right now? And this is the thing. Do you want to sell a G? Yeah. G's the Cadillac plan in today's world. You want to sell G. Problem right now is what we see is the loss ratio for Gs are over 100%. Right. And so when I say loss ratio is over 100%, 120, 140 I've seen pulling up surf filings. What does that mean? It means every dollar that they have coming in, they're paying more than they're getting in with claims. And that's just not sustainable. Right. And so a couple things, like if you're like, oh my goodness, what are we going to do? Well, I will tell you that MedSups are actually on the move upward. Like if you look at the data, we've seen an uptick in MedSups, even with all this turmoil. Yeah. So I think a couple things will happen.
Well, I mean, you also have the media that's really against Medicare Advantage, and because you hear the horror stories. Yeah. And so I do think that there's like you've got two things at work here. One, there's a reality, and then there's like a media reality of like, oh, these are awful, and then So there's a couple of reasons, but I do like so. Here's my thought, and this is what I've always said. Like, look, if all my clients were rich, I would probably sell 100% Medicare Supplement. But my reality is that I live in San Antonio, Texas. It has 65% people qualify for the low income subsidy, right? So we're seeing that, and again, like. I always, realistically, you have to place people on what they can afford. Yeah. And so that's a question that I have, just kind of going back to the innovative Plan G. In our conversation here, as we're talking about it, I do think that the high deductible Plan G would make a lot of sense. Yeah. And the question that I had as we were going through, and I wrote it down, is are the savings that you get with innovative Plan G theoretical? And what I mean is like, okay, we're thinking that we're going to keep the rates from going up.
Yeah.
Is that, or is it like we know that the rates are going to not go up?
We've seen it. So we've been selling this product since 2009.
Okay.
I was talking to a client about a week ago. She was 79. She had an innovative F because it was back when we sold Fs. And we used to have the innovative F. Now we have the innovative G. Her rate was 179. She's 79 years old.
Yeah.
Good. So it's worked. It's worked in the past. Now, have we felt pressure over the last 3 years? Of course. The question is, how do we get out of it? Right? How do we get out of it? And I think a couple of good things. So one thing that I didn't talk about, you talk about the media. Are we done talking about fraud? I feel like every time I turn on the news, something's about fraud. Yeah. And fraud's a big problem in the Medicare space.
Yeah.
So we've seen some people didn't like it. Back in February, Dr. Oz came out and he was like, no new medical device supplies companies are going to be able to open. And we almost like some agents were like, what? We're not doing medical devices anymore? And the concept was, here's what happens. These companies are committing all this fraud. Medicare is going to pay first, ask questions later, which is a problem. And then we finally find them and we shut them down. Well, they're criminals, so what are they going to do? Well, you shut me down, I'm just going to reopen.
Yeah.
And so we put this moratorium where no new ones could open. So I think when we start solving the fraud problem, it's not just going to help Physicians Mutual, it'll help all med sub carriers. I think hopefully we're going to do some things around the inflation problem that we're dealing with. But here's the thing. The innovative G, let's just talk about numbers here for a second. Again, G is loss ratios over 100% with all carriers. So I would have a problem putting my client on that. The loss ratio for the innovative G is about 45%. Now we're building that side. The more we build that side, the better. Because what I can tell you is about a year ago, 30% of all our sales were innovative. I'm telling you, innovative is taking off because our med subs keep going up and up and up, and 60% of our sales right now are innovative. Right. So the more innovative we can sell, the lower our rate increases will be in the future. And here's the thing, with the innovative, I used to tell agents like, if you don't sell them the innovative, if you're not talking about the innovative, someone else is. And I felt bad because I almost was like scaring them into it, like, you need to talk about this. Yeah. But now I think it's really just like join the trend, because there's a trend of people talking about it nationwide because we're looking for new solutions because the problems that we're seeing in the space.
Yeah, no, I mean, there's definitely problems. You mentioned how like some of these carriers will go 4 years and then they close it up. Mm-hmm. So has your Plan G not closed up?
We opened up a new block about 3.5, 4 years ago.
Right.
That block had been open for multiple years, more than the 4-year span. Okay. We're not trying to do the charter rotation. We're not trying to come into the market and have the cheapest price.
Right.
That's just not our plan, because if you look at those, and this is something I truly believe in, whatever the cheapest price is today, give it 3 years and it'll be the most expensive rate. Why are we thinking through the front mindset of, I want the cheapest rate for my 65-year-old client? All we're thinking about is 1 year.
Right.
What should we be thinking about? We should be looking at their rate long term. And I think it's just a different mindset that we have to have going into that market. And then here's the thing. What else is that med sup carrier doing for you? And more importantly, what is that med sup carrier doing for your clients? And so I don't think that we're just innovative when it comes to the innovative G, right? I think we're innovative when it comes to secondary benefits. So something I was really proud of with the new block that we rolled out a few years ago, we added Silver and Fit.
Right.
Which I will tell you personally, like I have a love-hate relationship for the gym membership side. So I started in the industry 12 years ago. I worked for a captive organization called Bankers Life.
Okay, yeah.
And as an agent at that time, they've made some changes. You only had access to med subs. So like, again, maybe I'm like biased because I've just always been on the Medicare Supplement side, right? But it was so funny. One of my first times I sat down with a client face to face, I was in the sales process. She wanted a Medicare Supplement, probably because I was pushing a Medicare Supplement. Halfway through the application, she said, "Oh, does this come with a gym membership?" I was like, "Do you even go to the gym?" Now that was like the worst thing to say, but it is. When you look at MAs, there's three reasons why someone's going to go with an MA. Number one, I think it's a good point. Some of it's zero premium. Yeah. Some of it's zero premium. And I think that's an important topic. But number two is dental. Number three is the gym. So in the state of Texas specifically, our Silver and Fit benefit is built into the price point. Many of our competitors, you're paying extra $20 to $30 to get the gym membership. Right. You told me not to drop anything. So you're paying an extra $20, $30 to get that. We have it just built in. But here's why I say I have a love-hate relationship, because I don't think you should make your health decisions based on a $30 gym membership that you can get at Planet Fitness. Like that, I personally don't think so.
I mean, that's probably the message to agents in general, whether you're selling a MedSup or a Medicare Advantage plan. Like, our message to our clients, our prospects, I feel should be, these are health plans first.
Yes.
Right?
Yeah.
And so we really need to make our decision based on, what do things look like if I end up in the hospital? What do things look like if I need an MRI, if I need surgery, if I need chemotherapy or radiation, right? Let's not make our decision based on, does this thing have,
I am curious,
gym membership?
Are there any data on the utilization on your plan versus, because
I bet it's low.
No, it is. My bet, and this is like completely has nothing to do with the conversation, but I am curious because on a Medicare Advantage, it's so low. But I would guess that it's significantly higher on the Plan G. People who can afford these Medicare supplements tend to be more health conscious,
have healthier lifestyles.
I would say it's under 10.
Still under 10.
It's
okay.
under 10. Maybe a little bit lower than, it's low. It's low. Because here's the thing, how many of us have owned a gym membership before and never gone to the gym?
Just don't go, yeah.
So, I mean, I am right there.
Right.
But here's what's important. I think you talk about these added benefits, right? Especially on the Medicare Supplement side. The big thing they're going to say is we have a gym. Like, I was on a stage last year with all these other carriers, and they were talking about how much they care about wellness, right? And they're touting this gym membership that some of them are charging an extra $30 for, so you don't care that much. But we are the number one provider when it comes to wellness because we have a benefit no one else has. So we have what's called the unlimited preventive benefit. And this is kind of going in the weeds of Medicare a little bit. So when you think about original Medicare and how it pays for preventive services, there's really two categories. There's preventive on a schedule, so like a colonoscopy. You can't go get a colonoscopy every year and Medicare pay for it. They just won't do it. It's every 5 years, which is standard. Good example, my father-in-law, back in his 50s, he had some friends that passed away from colon cancer. Him and his doctor said, we're gonna do it every 3 years for you, just because of your concern. Nothing diagnosed, just for preventive. He works for a company out of Dallas. They gave him a deal on a MedSup, so he didn't go with Physicians Mutual, which I'm still upset about. He should have, and this is why. Because he went and got his every 3-year colonoscopy. Medicare didn't pay the claim. That means his MedSup carrier, I was about to say their name, but we won't, starts with an A, didn't pay the claim. He got hit with over a $1,600 bill.
Jeez.
So we will pay preventive claims at 100% even when they don't fall on the Medicare schedule. But here's even what's better. So we think about, here's the thing. Let's say you work for Frito-Lay and you're on their health insurance. What do they want you to go do every year to keep your health insurance and to keep a good rate? They want you to go get an annual physical.
Right.
Well, Medicare just throws that out the door. Medicare will not pay for a true annual physical. They'll pay for a welcome to Medicare visit and an annual wellness visit. What does that look like? Talk to your clients. It means they sit in front of you and they say, how you feeling? You doing all right? Good. See ya. We will pay for a true annual physical. A true annual physical is about $700. So you want to talk about like value proposition? Take that $700, divide it. You're talking about a monthly value proposition of over $20 to $30 with that. Then lifeline screenings. So lifeline screenings are not covered by Medicare. They are for early detection of heart attack and stroke, which is a big problem in the senior market. We will cover that at 100%, another value proposition. And then let's talk about cancer, both skin cancer. We had an agent who's also a client, because you have those.
Yeah.
He has a concern when it comes to skin cancer. And he sat down with his doctor and was like, I'm concerned about this. Like, what test should you do? And she was like, really, like, this test we need to do, we're not going to do. Because you're not showing any symptoms yet, so we're not going to do it. Gee. And then his question was, well, when I start showing symptoms, will you run it? Yes. You know what will happen then? He'll probably be at stage 3 at that point.
Right.
So then it's a little too late.
Right.
And then another one is for breast cancer, there's this technology called thermography. Thermography is not covered by Medicare. We will cover it at 100%. So when we talk about like value propositions, this is true value propositions to be able to test something before you're diagnosed. Yeah. Because here's the thing, I encourage agents to tell this to clients. Like, why should you go get preventive tests and scans done? And like the easy answer, and we all know, well, it's early detection.
Right.
And then you follow up that question with, well, why does that matter? And here are the big three. I want better quality of life. I want longer life expectancy. I want more time with my family. And we provide that at Physicians Mutual with that benefit.
Yeah.
That's great. Yeah, I think that is a missing component, especially on people on original Medicare.
Yeah.
Like, is that prevention? I had a couple questions as you were talking. We do have a nationwide audience. What states are you guys actually in right now? I know that there was, I think last year when we were talking, that you were moving in new states. How many states is Physicians Mutual?
Yeah, so it really depends on the product offering.
Okay.
When it comes to Medicare supplements, there's probably 7 to 8 that we're not in. Some of those will be in later this year. But when you think of major markets we're not in the states that no other, like New Mexico is not a good state for carriers. New York is not a good state for carriers. So there are those big names. But yeah, we're pretty much nationwide, and I work with agents nationwide.
Nice. The preventive care, is that on all plans or is it just on innovative plan?
No,
It's a
so it's on
rider,
all
right?
plans. Here's the benefit in Texas. So we have 2 states, Texas and Wisconsin, where it is built in.
Okay.
We call it a rider because when we deal with other states, we charge $9 for it,
Okay.
which again, I think is a massive
it.
value proposition for an additional $9
Right.
to get that benefit. But in Texas, it's built into the price point.
Very cool.
That is
on the innovative Plan G. You talked. I want to highlight something that you talked about. I'm familiar with it, but I'd love for you to talk a little bit more about it. Like kind of the conversion of how that product actually works. Right. It's a high deductible Plan G for the year that you enter the policy, for the remainder of that year, and then 2 calendar years after that.
Yeah.
Once you've reached that point, it turns into your traditional
G.
Plan G.
And just because it's going up in coverage, the price isn't going up.
Right.
And so basically the idea is, so let's say, and I've seen it in some markets where you're looking at anywhere between a $30 to a $50 price difference between those 2 products that we sell.
right.
And so it's that benefit of locking in full G benefits at a discounted rate. Now, I would tell you the number one thing that holds back an agent is this concept of, but I don't want to stick my client with a max out of pocket. Well, we've been selling this product for a long time, so we have some data, okay? That first year they're on the innovative, and the same thing would be true for a high deductible G. The first year, 92%, or actually 93% will not hit the max out of pocket. Over a 3-year span, 85% will not hit the max out of pocket. Your chance of hitting that max out of pocket is so low. I tell people sometimes, if you had an 85% chance of going and buying a lotto ticket right now down at 7-Eleven, would you go buy one?
I would say so.
Yeah.
Yeah.
I'm in.
Yeah.
Let's
and
go.
so that agent shouldn't be afraid. But here's the even better thing. So let's say they're okay. And I always say, who's the right fit for an innovative G? Number one, someone who's healthy, right? And now, do I mean they're a marathon runner? No. It means to go to the doctor once or twice a year. Let's help them hopefully get in a plan that's more sustainable, that has a lower loss ratio. Let's help them out. Number 2, that person that's used to a max out-of-pocket plan. How many people do we sit down with, their current max out-of-pocket during their group years is $8,000 to $10,000. Yeah. And then number 3, and I think this is a benefit for agents in general that can help you sell a lot of different products, is do you have an HSA, a health savings account? Because you can leverage those HSA dollars on the coinsurance, on the deductible, towards the max out-of-pocket. Now, worst case scenario, I always have an agent tell me this, well, they're healthy right now, Robert, but what about a year from now? What if they get diagnosed with cancer? Here's the benefit of the product. It's not a lose product, because anytime during that elimination time frame, if their health changes and they want to move up to a full G, we'll allow them to do it without underwriting.
It can
Really?
upgrade to the
Full G,
yeah.
no questions asked. Even if you're that agent, you're like, hey, because a lot of people are talking about high deductible Gs right now. It's a big thing. Now, if you're selling a high deductible G, 2 reasons why agents don't sell a high deductible G. Number 1, they don't understand it. Number 2, the premium's too low.
Right.
And so those agents that are moving towards thinking about high deductible G, what do they have to be really good at? You got to be good at cross-selling.
Yeah, ancillary
You
products,
got to be
right?
able to cross-sell. But if you're moving, you're like, you know what? I want to start positioning high deductible Gs. Don't sell anyone but us. And this is why. We have a benefit on our high deductible G that no one else has. Anytime in the first 2 years, you can move up to a full G or to an innovative G without underwriting.
Yeah.
Again, we're innovative. We're doing things no one else in the market is doing.
That's
a big
really
deal
good.
because that's when you're at the kitchen table or you're on the phone and you're talking to somebody, there's that concern, right? What happens if I get diagnosed? What happens if I end up in a situation where I've got these really high out-of-pocket expenses? That's an easy answer, as easy solution as the agent is no problem. If you want to upgrade to a full plan G, you can absolutely do that. And there's not going to be any questions asked. You can absolutely do that. So that kind of crosses that off, right? Yeah. And then allows the agent to continue to position that plan and move forward. But like you said, right, to your point, you have to make sure that you've got the right prospect, right? If you've got somebody who maybe isn't, they have a lot of health issues and maybe they're coming off of plans where they find themselves constantly meeting their deductible through their group plan or hitting their max out of pocket, then maybe they're not the right fit. But that's where you look at the traditional plan G.
Yeah, traditional plan G or even a special needs plan. Like here's the thing, like I totally understand this. And for a long time, we've said 50-50, right? 50% of the market's going MA, 50% of the market's going MedSup. KFF came out with a study the other day. It's not 50-50 anymore. At least the study they did, and we could talk about San Antonio. I know San Antonio is going to skew, but overall it's 54%. But you know where 21% of the growth is coming from? 21% of the growth is D-SNPs, C-SNPs.
Right.
And those are the right plans for those individuals. Agents should be able to help everyone they sit down with, no matter what side of the fence, where the client wants to go.
Right.
Yeah.
I had we're running low on time here, and I just kind of wanted to jump in just a couple things and just to highlight. I thought it was cool. The underwriting for people who are, let's say they're coming off of a plan. It's been a year. I had one of our agents who's also a Medicare beneficiary. I think they were effective May of this year, and the plan that they signed up on, they got notice in July that they were getting a rate increase, right? So here we are 2 months later. Obviously, there's something they can do about it. They're in that 6 month. But let's just say that happens within that first year. I noticed that you guys only have 4 health questions.
Yeah. So we have limited underwriting. If they're between the age of 65 and a half, let's say that, because then they're outside of their OEP. 65 and a half all the way up to 68. We're only going to ask 4 health questions. We're not going to ask about prescriptions. And so, there's only four things to ask, and we can move them over to Physicians Mutual. Now, we have people that underwrite at all ages. Then it pops up to 12. We're very similar with other carriers when it comes to our underwriting requirements. But that's a big deal. People are looking for places to move clients, and I think you should be proactive. The worst thing to do is if you have a good mix of a block, your book, good mix. Like, you're heavy on MA. You do have a good side of the MedSup. The worst thing you can do is wait till AEP to flip MedSups. You should not wait till AEP to be doing underwriting on Medicare. You need to do it
them in
right
the summertime,
now.
right?
Yeah, you need to do it
spring.
right now. So AEP, you can make hay on the MA side.
Yeah.
Like you should be doing it right now.
For sure.
I think there's opportunity there. You see people, we're in a time where we're seeing some significant rate increases. If they're in that age gap from 65 and a half to 68, I think that's a unique opportunity with Physicians Mutual. But to your point, right, even beyond 68, we're not saying that they stop. You can still underwrite people after the age of 68, but up to the age of 68, it's four questions. So I love that.
Is the rate the same for a 65-year-old and a 67-year-old?
Yeah, so we have banded rates, and that was something I wanted to add to the end of that. That rate for that 65-year-old will be the same rate for a 68-year-old. We have banded rates.
Okay.
So that's going to be the same rate. And in the future, will we do banded rates in the future? I don't know, because it's naturally going to take our 65 rate up a little bit,
of course,
and it's going to take down that 68. But what we also
if you're at 40%,
yeah. And the other big thing is you have people now more than ever before. T65s are great. You have over 11,000 people per day turning 65. This is a year-round business.
Right.
But you do have more people than ever before that are hitting 65, and they're trying to make the decision, do I continue to work or do I wait? So some people would argue that the new age is really that 67, that 68 is that new age where people are really going on to Medicare.
Yeah, for sure. There should be a turning 67 campaign for sure. Let's one thing that I notice is, it's funny. I always think about things, and there's people in certain industries have been doing it the exact same way. And I knew an engineer who worked on roads, and I was like, why not do it this way? I was just curious, like, why not do it? He's like, well, that's just the way that we do things. And I feel like that's in a lot of ways the same way in our industry, and whether it's Advantage or Medicare Supplement, these are just, everyone does it kind of the same. But I noticed that you guys obviously don't just do it like everyone else is doing. So a question I have is, besides the Innovative Plan G, are there any other plans that you would say, yeah, no, we're thinking outside the box with this also? Like how's our dental? How's our,
Yeah. So about 4 years ago, we launched a new dental product, and I will tell you, it's taken off. Like so much, like more than what we expected. And I think because just like we innovate with the Medicare Supplement, we're innovative on the dental side. How many agents do you talk to and you bring up dental to them to get them to sell it, and they're like, I don't really want to do dental? Part of it because they don't see very many carriers that have a good value proposition. Right. So our dental has no annual max, no deductible. We have one of the largest networks in the nation. I mean, I get, just like agents, I get emails from carriers, and they're like, large network, 200,000 providers. No, that's not a large network, right? Stop lying.
Right.
We have over 600,000.
Jeez.
It's a PPO. You can go in network, you can go out of network.
Is it someone else's, or?
So we use the Emeritus network, the classic PPO Emeritus network. But I will tell you, when it comes to point of sale dental, we have the best plan out there. Here's the thing. Here's the benefits. We're going to pay 70% on major. We're going to pay 70% on basic. We're going to pay 100% on preventive. In the state of Texas, we're 59. Based on the state, it's anywhere between 59 to 65. I will tell you, I don't know of very few carriers that offer that level of benefits at that price point, and then none of them, all of them, not none of them, all of them have an annual max.
Right. What's the and I didn't mean to cut that point off because that's actually really good. No annual max. What is the? Gosh, I lost my question because you hit me with it.
I think from a price point perspective, though, right? Like an agent can hear that number, like that's high, right?
Yeah.
But think about the value that's built into this product.
And we have plans as low as $30, right? We can, the Premier plan is, because what I want to do with the Premier plan is you look at some of our competitors. Like the big name right now in the industry is NCD. Why? What's really flashy, and it's kind of what we're flashy for, is their annual max. Like it's not that they have no annual max, but their annual max is $10,000. And so you have people flipping their plans like nobody. They're just slinging NCD dental all over the place. How much is their plan for the same benefits? It's $95 to $105. So on that high side, they're the highest, but they're slinging them because they have a $10,000 annual max. We're about half of their price point. Plus, we have plans that go as low as $30. And here's the thing: there's disruptions on all sides of the house. I think we're going to see more of a cut in dental and MA this AEP. We saw some cut in dental benefits last year. I think we're going to see it again. But it really creates an opportunity for that agent, because that MA agent can not only walk in the house and get that MA, but you can add a secondary dental. We don't coordinate benefits. So if they have some dental benefits with their MA, they can use those benefits and use ours to give them a fuller picture. So we have the dental that's really special. And here's the last thing, is we just launched a new product. It was about 3 weeks ago. We're calling it the Secure Essentials Life product. And I think we need to rethink as agents. Like, you have some agents that have never sold a life policy, and you have agents that know they need to sell it. And usually we think in the terms of whole life. When you think about the senior market, they don't need term, they need whole. And in some ways I agree. But here's the statistics right now. 47% of people between the ages of 60, 70 are still paying off a mortgage. 13% of them feel like they're never going to pay it off. Right. And so we rolled out with a product that starts at 15, whole life, goes all the way up to 100,000. If you're used to like carriers out in the space, Mutual Omaha, competitive rate. American Ambulance, competitive rate. Transamerica, competitive rate. Our price point is either right where they are or we're less, especially Transamerica and American Ambulance. Best rate out there. But we do something no one else does. We're going to allow you to put that whole life product and add a term to the same product. Simplified issue, instant decision. So they get both. They get a whole and a term in one product. And if you want to, and here's the thing, just being fully transparent, we're in a world on Medicare Supplement agents are losing tens of thousands of dollars. You know why? Because they're no longer getting paid for PDPs. And I talk to agents all the time that are trying to replace an extra $10,000 to $20,000. You can do that like that with life. Then you have agents that, here's the thing, you know what they want to sell? They want to sell the HMO. 2 years ago, they were not. They're selling the HMO now because PPOs are becoming non-commissionable. And so they're trying to replace income.
Right.
Life, dental, we don't do hospital indemnity, but that's a product you should have the ability. And here's the slogan I would use. When you're sitting down with that client, you should tell them this. I want to help you get the same or better benefits in retirement than you did in your working years. That means you're not just replacing their health insurance, you're looking more holistically at what they had before.
Yeah, and there's more to it, right? I mean, we've had this conversation before. You place a client of yours, if you have one product, one line of business with them, your retention may not be as high as it would be if you had multiple products with them. Yeah. So it leads to retention. You know, you're obviously bringing more value to the member around their health, their benefits, however that looks, whether it's in the form of a Medicare Advantage plan, a Med Sup. If you're packaging that with a dental product, a hospital product, you know, it is bringing value to the member and it's adding more protection to them. But also from an agent standpoint, we talked, right? We're seeing a cut in commissions. We're seeing we're seeing more non-commissionable plans. This is an opportunity for an agent to diversify, you know, their portfolio and figure out, get creative, get innovative, right? With ways to generate more revenue to their business. Yeah. And so I just wanted to kind of highlight that point because I think there's value in that for sure.
Anything that we didn't touch? Oh, actually, I did. Let me go back. I finally remembered.
You got this question.
What's the waiting period for on the dental?
So that's a good point. And when I say it's the best product to sell at point of sale, and the easy point of sale is, do you want this with or without dental? You'll sell dental at a 70% rate. Do you want it with or without dental? Boom, you're done. But it's the best of point of sale. The reason I say that, preventive will start day one. Right. Basic will start day one. So think of cavities, tooth extractions. We do a 1 year waiting period on major. Okay. So when you have that client, and again, this is usually our fault. When you have that client that's 6 months, a year, 2 years down the road, they call you and they say, hey, the first one is, do I have dental? It's like,
you know if you have dental.
You would know, right? But I need dental. Why are they calling you? Because they found out they need 5 root canals.
Right.
Yeah. You know, at that point, you know, there are carriers that will give you day one coverage.
Right.
Now it's low, but it's something.
Right.
It's something. But I think we have the best product when it comes to, again, that point of sale. Getting them on something will offer them the best benefits long term.
Yeah.
Okay, that's awesome. Yeah, that's actually a really strong product. So yeah, you know, I'm surprised we hadn't talked more about it in the past. So, well, I really appreciate you being here, man. You drove from Austin to San Antonio to be here today. So just want to thank you. And how can people find you if they're looking for you? What's your I know you have a TikTok. What's your TikTok handle or?
Medicare Rob. Medicare Rob. But look me up on LinkedIn, Facebook. I'm everywhere. And if you do work with Physicians Mutual, one of the biggest things, I talk to agents all the time, the biggest thing that agents need is support. Yeah. And so we really pride ourselves, not only me, but I believe everyone that works for the company with the field, is we want to be available. I think that's our greatest ability, is to be available, especially going into seasons like AEP. Yeah. When you have a question, you need an answer. And we want to be there for you.
It's true, man. I text you randomly with questions all the time. I always get an answer really quick. So appreciate that and appreciate you being here today. So thanks so much. Until next time, thanks for tuning in.